Hello, good afternoon, everyone. Let me say that again. Good afternoon, everyone. We'd like to welcome you all today for our first patient care group event of the year. And it's with great pleasure that we're going to be doing on sickle cell awareness. And it's going to be a powerful event. Many of you are going to leave here today with a great knowledge and understanding of why we're doing this event that affects so many people. But unfortunately, not a lot of us are really up to scratch with the understanding of sickle cell. But after today's event, you're going to see how powerful this is, okay? So just some housekeeping rules at the beginning. First and foremost, there should be no alarms today. So in case of an emergency, all you need to do is just make your ways right down to the back there in case of any emergency, a fire alarm goes off. We're not expecting no fire alarms today. So if the one does go off, then just make yourself right back down those stairs there as well, okay? And also, please, if you would like to just keep your phones on silent, just to double check that your phone's on silent. That's it, so we don't disturb people speaking today, okay? All right, so the first thing we're gonna do today, we're just gonna give you an insight with regards to a lovely video that was shot, which explains a person going through sickle cell. It's a music video, so keep you jumping, but pay close attention to the video, okay? And then afterwards, we'll have our first speaker, okay? You ready? Yeah. All right, okay, so let's watch the first video.
Yeah, let me clear this now. Fam, this ain't a minor pain, it's the kind of pain that you don't hear about. So hear me out. From as young as 5, getting rushed to the hospital, I still remember clearly, wow. I can still hear the screams, still hear the shouts. Blue lights and ambulance noises, wheelchair and oxygen mask. I got to be daft if I plan to avoid it. Can't handle the voices telling me calm down but don't know the pain. Looks everywhere, you don't know the shame. Sickle cell anemia, if you don't know you will know today. Sharp pain in my arms and legs, feet, palms and chest, calves and head. Breathing levels decreasing, feeling like my pulse at an end. Still air in my lungs, I must breathe. Feels like no one's here, it's just me. I'm in a room full of people, yet no one feels pain but me. This feeling's insane, trust me. Wish you could feel my pain, it cuts deep. No white lies, stop turning a blind eye and try find the time you must see. Our people been suffering so much and our own peers weren't taught about it. This pain's been hidden for too long, now it's time that I talk about it. Trying to find a way, put a smile to mask the pain. No longer will I hold this shame, releasing all this hidden pain. Trying to find a way, put a smile to mask the pain. No longer will I hold this shame, releasing all this hidden pain. Cut the silence, now I got to talk. Fam, man could have lost it all. Doctors trying to convince me it's not your fault. Spent days and nights in the hospital, half-term birthdays in the hospital, Christmas, New Year's in the hospital, parents and peers in the hospital. Man, I've shed some tears in the hospital. Can't take more blood from a thinner vein. Time to be real again. You see my joy, but try to see my inner pain. I was 25 on a Zimmer frame. Hip replacements, skip the fake and sick of waiting. How long till I live again? I just wanna be free. Don't wanna go through this again. So I just stare at the picture frame and try to see the big picture. No more pain in the sky where we link up. One way you can help, give blood. Try to understand this kind of pain. I'm tired of trying to hide the shame. Most times I'm drained, but I disguise the pain with a smiley face. Awaiting the whole sequel. Shout out my fighters, we're co-equal. And it brings pain to my heart when I gotta bring awareness to my own people. Our people been suffering so much and our own peers weren't taught about it. This pain's been hidden for too long, now it's time that I talk about it. It's real. Trying to find a way, put a smile to mask the pain. No longer will I hold this shame, releasing all this hidden pain. Trying to find a way, put a smile to mask the pain. No longer
Wow, powerful video, yes? For those who haven't experienced what sickle cell is, and those who have sickle cell, they can really have a true understanding of what this video represents. So it's with great pleasure today I'm going to introduce our first speaker, because Miss Samantha Greaves is actually a sickle cell carrier, but she's a massive advocate for fighting the good cause, to promoting how to overcome the help people need. I've known her for 9-10 years, and it's a real pleasure to have her here today, because it's not something we can take for granted, because sometimes when they have a crisis, they can't even get out of the house. So I'm truly grateful today to have her here with us to give our talk. So please join me giving Miss Samantha Greaves from Sickle Cell Cause a big round of applause, guys. Okay.
Greetings, everybody.
So you just push the slide.
Okay. Sorry, I've got to sort myself out. Okay, so this is my fourth time speaking on the stage of the UCKG, so it's a great honor to be back. It's been a few years since before COVID, when we was last here, but it's very nice to be back, and especially during Sickle Cell Awareness Month. Okay, so it's on the wrong page, so I don't know.
You can do an introduction.
Okay. Okay, so as I said before, first of all, let me just say, I am not medical. I'm a sickle cell warrior. That means I have the sickle cell condition. I have SC disease, which is the full-blown. I also run a sickle cell support group. I've been an advocate since 1997, and since 2003, I've been on the committee of certain sickle cell support groups. And we run the support group from the George Mars Centre, which is based in Tottenham, St Anne's Hospital, and we're still there. So, as you know, we're in September. Thanks very much.
And then you press the next one.
Okay. Oh. Okay, thank you. Right, little technical stuff there. So as I was saying, September is World Sickle Cell Awareness Month, and I'm here today to speak about not what sickle cell is, which I've been doing before. I'm here to speak about the importance of community sickle cell awareness, Sickle Cell Awareness Month, and being sickle cell aware. You know, so let me just look at my notes, because I've been, okay, so. Right, so far this month, because I said that we're a sickle cell support group, so far this month we're very busy and we're patient. You know, and I'm mentioning this now so that you know that it's patients that's doing a lot of the work. Right, the first sickle cell support group was created by a sickle cell patient, the first group in the UK and Europe. It was called OSCAR, the Organisation of Sickle Cell Anemia Research, in Wood Green. Right, it was the first group in the UK and Europe. A sickle cell patient did the groundwork, done the research, went to Africa, Jamaica, and the USA, you know, did the research and came back and built up a support group, which did research. And then every other support group or organization is built off the back or the blueprint of that work. So that's why we have sickle cell support in the community to this day. But I just wanted it to be known that it was started up by a sickle cell patient. So who am I? So I am a mother and a grandmother. I mentioned that because at the age of 7, I wasn't expected to see 14 to 21 years. So the fact that I managed to be a mother and a grandmother, to me, is like, okay, I've made it, I've done something. I'm an initiate of philosophy, Kemetic philosophy and spirituality, so I've done my study and I have passed the first level, and that's why my name is also Karsheta Penebves. I'm a community volunteer since 1997, as I mentioned before. I'm a member of the Gift Genius African Heritage Wealth Empowerment Program, and that's where we try to create wealth in our community and help, our families and friends, especially like in the Gambia. I'm a sickle cell warrior. I'm a patient advocate, and I'm the founder of the Sickle Cell Cause Support Group. But as it says there, I'm not a professional. I'm not a medical professional. Right, so a bit of history about sickle cell in the UK. I'm going to speak fast because I've got 20 minutes and I've got a few slides to do, so I'm going to speak as quick as I can. Right, so Neville Roy Clare, right, founded the Organisation of Sickle Cell Research. It started from 1973, but it was founded officially in 75. And it was the first group in the UK and Europe. Nurse Susan Treasure, she was like one of our nurses, and she was a specialist nurse. She joined Neville later on, and they started up the first support group, which is more community-based. So the first one, Oscar, was more research-based, and did a lot of fundraising and so forth. And then the support group, where Susan was involved, was more community-based, more peer-to-peer support and so forth. And later on in 2009, a couple of decades later, Nurse Susan started up the Enfield Sickle Cell Support Group, which I was working from when I first met S. In 1985, well, let's go back to around about 1983, we was having a sickle cell support group meeting in the offices in Wood Green. We used to borrow offices. This is before the centre was built. And the person that had the key in the evening we was meant to meet hadn't arrived yet. So we was all huddled up. There was about 15 to less than 20, about 20 of us, less than that, huddled outside underneath umbrellas, waiting for the person with the key to come and open the door. And it was raining. And then who should drive past but Dr. George Marsh, and he was our consultant at the time. And what he's seeing in the rain is a lot of his sickle cell patients huddled up under umbrellas, and he knows that the rain, the weather, can cause a sickle cell crisis. So he was in shock and wondered what we was doing there. So he stopped his car, asked us what we was doing there. We explained that we was about to have a support group meeting. We invited him to attend that meeting. He came in, he sat in on that, and it was then that he decided that, or he realized that the sickle cell community needed a center for themselves. So he then campaigned with his staff, his peers in the NHS, and his bigwigs, in the government, and we were involved. We did fundraising, pushing beds down the high road and things like that, and then that was the beginning of the centre being built in St Anne's Hospital. It was going to be called the Sickle Cell and Thalassemia Centre, but because Dr. George Marsh sadly died in 1988, the centre was officially named in his honour. So I mentioned this so that you know that the Sickle Cell Centre, Sickle Cell and Thalassemia Centre, would not have been standing if not for the work of Neville Clare, a sickle cell patient, and the support of our consultant at the time. Sadly, he didn't see the centre open. It's still in the grounds of St Anne's Hospital to this day, and that's where we work from. Okay, so I forgot I've got to change the slide. Oops. Okay, so I know that we've got a nurse in the house that's going to be speaking about what is sickle cell, but as a sickle cell patient, I just want you to know what it feels like a bit to live with the sickle cell symptoms and things that you can notice a bit. Like if you see somebody with sickle cell, there's a yellow tinge to the skin, and this is like average symptoms from childhood: numbness of the limbs, severe pain and swelling of the joints. There could be slurred speech, there's constant headaches, fainting and blacking out, difficulty sleeping and even waking, tiredness, complete lack of energy, there's chest pain, anxiety attacks. Then there's epitaxis. I have that quite often when the nose just bleeds for no reason. Unquenchable thirst, I'm thirsty now. There's furring of the tongue, right? There's what we call dropsy, when you just drop asleep, whether it's hot or cold, anywhere, day or night, you just drop asleep. There's breathlessness, consistently cold, priapism, and that's when the penis swells up, lumpy, and it won't go down, and this can last minutes, hours, or days, and it's very painful, and it can cause impotency. And the results of all of these average symptoms of the average sickle cell patient, right, including the conventional medications, these can, manifest into like jaundice, iron overload, migraines, gallstones, breathing difficulties, swollen and removal of the spleen, reduced bone density, delayed growth, chest infections, leg and stomach ulcers. I mean, you can read all of that yourself. So you can see that living with sickle cell is not just a case of, oh, I've got a bit of pain, so give me a Panadol. It is a case of like other conditions manifest from living with sickle cell. Right, so here's a few statistics. Right, so sickle cell was first medically recorded by a Chicago dentist in the 1910. Approximately 1 in 79 babies are born with sickle cell trait in the UK. They say statistically that there's 17,500 people recorded to have the sickle cell disorder in the UK currently. Almost 300 babies are born with sickle cell every year. And the sickle cell condition is the largest genetic and blood disorder worldwide. So not only is it the largest growing blood disorder, it's the largest genetic disorder. And the average life expectancy, they say, is now 47 years. When I was a child, it was like 5, and then it went up a bit. I was told 14 to 21 years, so that got me in a mindset of that, But they do say now, with due to improvements and management with infections with children, it's improved, so we are living older and up until 67 years, right? But people say, like, remember, I'm here because why do we have Sickle Cell Awareness Month? Why is it important? Why should the community know about it? Well, because of what I've just said, first of all, it's sickle cell patients that started it off in the first place. Thank you. And then there's the fact that we live with pain. Constant pain. There's not a moment that you're not in pain. It's just a degree of pain and what you're taking to manage that pain, right? But there's also a lack of empathy. When I say lack of empathy, I've got some notes there. I can talk about things like being informed when you're 7 that you're going to live for 14 to 21 years. Right? Having that knowledge or that information can make you live a very cavalier life. Right? My teenage years was very cavalier, I could say, because I wasn't expected to live. I didn't expect nothing of myself, so it was a life of pain. They didn't know anything about sickle cell, so you just live that life not expecting nothing much for yourself, right? That is trauma, mental trauma, and they have you living with that, and I'm not the only one. They gave us sell-by dates, as we call them. They've stopped doing it now because they realized that it is not the humane thing to do, but that is what they was doing back then in the 60s and the 70s. There's lack of awareness in schools and workspaces. I remember being in school, in the cold, they used to throw you out in your knickers and vest to run up and down at playtime, at PE. This is rain, sleet, or snow, you're out there having sickle cell crisis. There's just a lack of empathy. I've had so many jobs in the workplace with people not understanding what sickle cell is. So I had many jobs. In the 80s, I used to have I had so many jobs, it's uncountable. In the end, I just had to do temping, just so that I could be in the workplace and do something, get paid for, and not work when I was too sick to work. So there's a lack of empathy. There's a lack of also untrained medical staff. There's nothing worse than being in sickle cell crisis and a doctor comes up to you and says to you, how long have you had sickle cell? That is a question that it brings tears to you. It's like, you don't want to hear that. You're in enough trauma and pain. If your doctor's asking you that, that's telling you that the doctor doesn't know what sickle cell is, and now you're there having to teach him. In many cases, the adult sickle cell patient is the expert in the room, right? Sickle cell not being recognized across the board as being a disability for everybody. With other illnesses, life-debilitating, life-taking, painful, conditions, prescriptions are free, but not with sickle cell, right? If somebody said, oh, I've got cancer, there's things in place that you don't have to struggle too much so that you can, of course you're going through what you're going through your traumas and that, but there's things in place so you don't have to struggle too much. In the case of the sickle cell patient, you have to fight as an individual, your housing, I can't be on the 16th floor because of the altitude, I'm going to be dizzy. Furthermore, the trolley's not going to fit in, you know, like when the ambulance come, when I have my crisis and the ambulance, it's not going to fit in the lift. So I can't be up there. I can't have draft. You know, there's many things that needs to be in place, but you have to fight as an individual. Everybody's fighting for themselves. And that's the reason why there's so many support groups dotted around the place, because it's not recognized as a disability flaw and not being taken seriously. If you say you're in pain and people are not believing you, it's the worst thing ever. I forgot I'm using this thing. All right, I know my time's only finished. And the last thing I want to say, sickle cell is racist, systemic racism when it comes to sickle cell. They say to me, oh, you're being paranoid, you've got a chip on your shoulder, or you're throwing the black card with all that information I've just said to you. These are facts because this is my lived experience, right? But if you look at sickle cell, let's do some statistics with sickle cell and cystic fibrosis. Sickle cell, the ethnic groups affected is mainly predominantly African and Caribbean. Numbers affected in the UK, this is their notes, this is their record, 17,500 patients. When was the abnormality identified? 1956. How many drugs developed for the disease? 3. And the third one was developed in March of this year. So since 1956 to March of this year, there was 2, right? And transplantation available for adults started in 2019, right? Now look at cystic fibrosis. Right, the ethnic groups, you know, predominantly affected, or the white community. Numbers affected, 10,500. So there's a big difference in numbers. Right, when was it identified? 1988. Drugs developed for the disease since then, 511. And I forgot to mention one of the traumas is drug testing on our bodies, using sickle cell patients for drug testing, because if we've got free drugs, who are they testing drugs for? Okay. They've got 511, and the transplantation was available since 1989. So a year from it was identified, a year later, transplantation was available. With the case of the sickle cell patient, it took 30 years. You know, so we can say this is the reason why we need sickle cell community to be aware of what sickle cell is and why awareness is so important, and why we say, please be sickle cell aware. And our details for the sickle cell cause is this. If you want to help us, we're looking for volunteers. Also, please know your blood type. Please get tested. You don't want to go and get married and have children and find out at that point that your child has got sickle cell. And also, if you're in your summer years and you've got your first grandchild and that, you don't want to be presented with a sickle child that you didn't know about, that you can't, you know, you don't know how to assist. So come to us. We're at the George Marr Centre. This is our information there, and if you want any more information, I'm sat over there. So thank you very much. That's it.
Thank you very much. Cheers. Thank you. Another round of applause, guys. Yeah. So that was very informative, very deep, that understanding. As I said, for those like myself, don't really know too much about sickle cell, I've never really invested in looking in sickle cell. But I must admit, ever since I've met Samantha, I've taken more of an interest. And as you know, when we do our PCG work, you're meeting a lot of people with sickle cell. This understanding now helps us when we go to the hospital, that we can get a better understanding as well what a person is going through. So you could imagine the pain that they're going through. I know there's quite a few families here today that are talking about who have experienced this as well. And we're going to have a good questions and answers session as well. Okay? So now we're going to go into the nitty-gritty of how sickle cell comes about, what we can do to help as a community. And yeah, it's next to bring our nurse from Whittington Hospital. Her name, give her a round of applause. Okay. Come this way. Okay. She is going to talk today. Her name is Miss Grace. I'm bad with names, as everyone knows. Esther Ogene is my name, so don't be too hard on me. But it's Miss Grace Adeji Ajay Clinton. A round of applause again. Okay? There you go. All right.
Good afternoon, everyone. Welcome. So So my name's Grace Ajay Clinton. I'm a specialist sickle cell and thalassemia nurse. I've been working in the world of sickle cell since 2011, worked in a lot of East London hospitals. I'm trained as a paediatric nurse, but actually I work with adult patients as well. So I'm just going to give you what I call back to basics. I'm not very good at this. So I'm going to give you a bit of back to basics and a bit of a biology lesson today so that you understand what sickle cell disease is, what the difference is between trait and disease or disorder, and also where you can get tested if you want to get tested, if you've got children that need to be tested, if you're planning on getting married, where to get tested, and also if you're willing to donate blood, which we really need from our Black community, what you can do for that as well. Okay, feel free to interrupt me if you don't understand something. So the origins. So why do we have sickle cell? And it's not just sickle cell, there are unusual hemoglobins as well. So the scientists believe it's a result of malaria, and actually the human race has devised a way of protecting itself from malaria. Okay, so we've got the mosquito fly here, and that's something that carries the malaria illness and pass it on from person to person. Okay, so you tend to find people that have the sickle gene, all these unusual hemoglobins, come from certain areas of the world. Okay, so as you can see in blue here, it's highlighted sub-Saharan Africa, Southeast Asia, the Mediterranean, Middle East, and the Caribbean. So you tend to find that people that have ancestry from those areas tend to carry the sickle hemoglobin gene. Okay, but as I said, it's not just that sickle gene. There's also thalassemia, there's hemoglobin C, hemoglobin D, E, there's lots of them, okay? Okay, so the prevalence in the UK, it affects about 300 pregnancies per year, and about 12,000, well, 12 to 17,000, there's not a clear number of how many people carry sickle cell disease in the UK, but from the National Hemoglobinopathy Register, for those that are registered, it's approximately about 12 to 14,000 people with sickle cell disease. And on average, we have about 300,000 babies born each year that are sickle trait, or carriers of a different hemoglobin. Okay, so this is the biology part. Okay, so what makes you you? So what makes you you is your genes, the genes that you inherit from your parents. So the reason why our hair might be curly, might be straight, why we have particular eye color or the shape of our nose, is all because of the genes that we inherit from our parents. Okay, so if we home in on that, sickle cell disease is about the blood, okay, and it's particularly about the red blood cells. But what do the other cells do? So we have plasma, which is part of the fluid that transports all those cells in your blood along. You have your white blood cells, which are there to fight and protect the body from infection. Oh, hello there, I've just seen you. And we also have red blood cells, which are there to transport nutrients around the body and to remove waste products. Okay, we also have platelets, I haven't written it here, which is part of your clotting factor. So when you cut yourself, you don't continue to bleed, you actually form a plug which holds the blood in. Okay, so we're actually going to focus on the red blood cell. Okay, so all these cells in the blood are made in your bone marrow. Okay, your bone marrow are in your long bones, and it makes the red blood cells, the white blood cells, and that's what your GP is looking for. When you go to your GP and you say you're not feeling well, generally he takes a blood test called a full blood count, and he's looking at the cells that are made from your bone marrow and what they're doing. Okay, so red blood cells, as I said, the function is to transport nutrients around the body, to remove waste products, and within your red blood cell is your hemoglobin. Okay, so your hemoglobin is a gene, so you have to inherit that from your parents. Okay, the red blood cell, the shape of it is like a donut. It's nice and spongy, it's nice and pliable, so it can slip and slide over each other when it's going through those vessels, doing a perfect job. Okay, and the red blood cells generally live for about 120 days, and the body has a great way, a great mechanism at when to break it down and to make more. Okay, so adult hemoglobin. So adult hemoglobin is made up of 2 alpha genes and 1 beta gene. Okay, and if that process is completely normal, it equals what we call hemoglobin A. Okay, so that is the normal adult hemoglobin. So from your mother, you should receive 2 alphas, 1 beta to receive hemoglobin A from mum, and then the same from dad. Okay, so that should now equal adult hemoglobin AA. Does that bit make sense? Awesome. So people get confused with trait, carrier, minor. It all means the same thing. It means you've received 1 normal adult gene from one parent, and from the other parent, you've inherited something else. So it can be the sickle gene, it can be hemoglobin C, D, E, or all the others. Okay? So when you are trait or carrier, so professionals tend to say the word carrier, lay people tend to say trait, it means the same thing. It means you've got a normal gene and you've got a variant hemoglobin. Okay? So if you're a carrier, it means that you are healthy. You should not be experiencing any symptoms. However, some people have told me as carriers for sickle cell that they do experience symptoms of joint pain. But generally, you should be a healthy carrier. So a lot of people come and ask me, or are a bit shocked, usually when they're pregnant, how come no one's ever told me that I'm a carrier before? I've had blood tests before. No one's ever told me that I'm a carrier. As I said, your GP doesn't tend to look for these genes. It's not an illness, it's part of your genetic makeup, okay? So usually when we test in the UK, we're testing when you're pregnant because we know that you can pass the variant hemoglobin gene to your child, or we test when you have an operation. So all anaesthetists are supposed to test you prior to being put under general anaesthetic, because if you're a carrier for sickle cell, having a small amount of oxygen can change the way you make hemoglobin. So they need to know because they're controlling the amount of oxygen you're receiving when you're on the table, yeah? And the other time that you're tested is newborn babies. So all newborn babies are tested on day 5, which is part of the newborn screening program. And again, that's information given to the parent so they are aware, okay? So those are the times when you are routinely screened for variant hemoglobins. But your GP, if you went and told him you were fatigued and tired, would not routinely look at that. He would do a full blood count. He might look at your iron levels, but he would not look for your genetic makeup, okay? So most people, yeah, go ahead.
Sorry, I just wanted to know, when they do the new baby screening, when do they start that?
So from 2006, it was made mandatory for all newborn babies to be tested. So if you're born before that, most people don't know, okay? It would have been an ad hoc thing if your GP thought, okay, well, you're black enough, let's test you, yeah. So that's why it's good to get tested if you're born, especially prior to that, or if you're born in a different country, or they just can't find your records. It's still good to get tested, okay? So what is sickle cell disease? So sickle cell disease is when you have no normal hemoglobin, okay? So that could be SS, It can be SC, SD, as I said, there's lots and lots of them, okay? So that means you have no normal adult hemoglobin, which is the A. Does that make sense? Okay. So, for example, a newborn screening result for me, I would receive something like hemoglobin FS. Okay, so F is actually a different type of hemoglobin called baby hemoglobin or fetal hemoglobin. And if I'm only seeing S, it means that the baby has a type of sickle cell disease. Okay, don't know which one until I've tested the parents and done some genetic tests. Okay, but because there was no A, it means the child is not a carrier. The child doesn't have any adult hemoglobin at all, so it's a type of disease. If I receive the result HbFAS, then the child is a carrier, okay, because there's an A. Does that make sense? Okay, so sickle cell disease means that you've inherited 2 abnormal hemoglobin genes. Predominantly, sickle would be the most dominant. So as I said, it affects generally people from those certain areas of the world that usually have a problem with malaria. Okay, it is an inherited anemia. There are lots of different types of anemia. There can be iron deficiency anemia, which is completely different. Okay, iron deficiency you can manage with medication. Yeah. So if you're a woman of a certain age, you lose your blood each month with your period, you may lose iron. Okay, so therefore we can replace the iron. Or if you're pregnant, you lose iron because baby's taken all the iron from you. Okay, or you may not absorb iron very well. Again, we can manage that by giving iron supplements or iron infusions. But for sickle cell disease, it doesn't matter how much iron you give the person, it doesn't change the disorder, okay? Because they don't have a problem with their iron in general. It's to do with the protein gene they've inherited, okay? The severity of the disease and anemia is variable depending on the type of sickle cell disease it is, and also lifestyle, okay? I think climate has a big deal to do with it as well. I tend to have patients coming from Africa that come pregnant and they're unaware that they have sickle cell disease. And I sometimes am the first person to tell them, you are hemoglobin SC. And they're shocked, like, sickle cell, where's that come from? When I tested back home, they told me I'm hemoglobin C. And I said, well, you're S as well. So it's SC. And they're shocked. And the reason why they don't know, one, maybe the test that they had back home was not specific enough and not picking up the genes correctly, or because parents were unaware that they are carriers. And being in a warm climate, they tend to not have the painful crises that patients here have. So maybe they did have pain, but they would have been told, oh, it's growing pains. Don't worry about it. Okay, so some people, depending on their lifestyle and climate, sometimes don't even know that they have sickle cell disease. So crises, very unpredictable in nature. You cannot sometimes know when it's going to happen. There are certain triggers that can precipitate it, but for some occasions you don't know what the trigger is. It can just occur. Crisis means an overwhelming event. So the most common type of crises would be a painful crisis, okay? But there is infective crises and other types of things that can cause this overwhelming event to occur. So in the UK, as I've said, that all newborn babies are tested on day 5. If the baby does have a type of sickle cell disease, parents are informed by the time the child is 4 weeks of age, and that's not a nice job. And then they have to see a doctor by the time they're 12 weeks of age, started on medication, and seen regularly after that. Okay, so most people think that sickle cell is about being black. It's got nothing to do with being black, okay? It is a genetic disorder. It's genetic. And as I said, it's to do with malaria. So if you've had ancestry from those certain areas of the world, yes, you may have inherited those genes, okay? It is not to do with being black. Yes, the majority of people in the UK are Afro-Caribbean. However, we do have people that have fair skin that also have sickle cell disease, okay? So the sickle red cell. So you remember I was telling you about the normal hemoglobin, normal red cells, nice and spongy, lives for 120 days, does a fantastic job. So the sickle red cell, if you think of a paperclip, so a paperclip has got quite a nice, strong shape, okay? If you bend the paperclip and then you try to put it back into its normal shape, it doesn't quite go. This is exactly what happens with the sickle red blood cell, okay? So instead of maintaining its shape, every time it gives oxygen to the vessels, to the organs, it changes shape. Now that repeated process causes the cell to break. So instead of living for 120 days, would only live for about 20 to 30 days. Okay? And every time it changes shape, it's not nice and soft and spongy, it's rigid, it's sticky, it's hard. So as it's going through those vessels, it actually damages the vessels and it damages the organs over time. It's a progressive disease, okay? Sickling is happening all the time. Even if the individual is not telling you that they're in pain, that sickling is happening all the time. Okay, and over time, and the triggers would cause obstruction to the vessels and can cause this pain, and it's usually joints and bony areas, but actually it can happen anywhere in the body. Okay, as I said, I want you to be clear that it is a genetic anemia. So genetic anemia means that we cannot change it with medication. Okay, we cannot cure it unless you're going to do bone marrow transplant, as Samantha mentioned. And now they're bringing in something called gene therapy. Okay, so with a genetic anemia, it means that you do not carry enough oxygen within your body. So a normal hemoglobin level is usually around 115 to 180. Grams per litre. For somebody with sickle cell disease, it can be as low as 60. So that is dramatically lower than the average, okay, and would lead to symptoms. Okay. So just for you to understand what the sickle red cell looks like, I've put it in yellow. So you can see that how rigid it is. It's completely the wrong shape. Can easily block those vessels compared to the spongy hemoglobin, adult hemoglobin you can see behind. Okay. So unusual hemoglobins, I just want to add a little bit about that. Unusual hemoglobins, as I said, there are absolutely thousands. Okay, the most common ones that we look for most common ones that we look for, hemoglobin C, very, very common in Caribbeans and West Africans. Hemoglobin AD Punjab, very prevalent in the Punjab region of the world. Hemoglobin E, more common in Southeast Asians, Pakistani and Bangladeshis. And then the beta thalassemia gene, which is more common in the Mediterranean areas, okay? But not exclusive. So you can have a Ghanaian that is a carrier for beta thalassemia. Okay, so in terms of inheritance patterns, if you've got two parents that are both hemoglobin A, okay? Hemoglobin A, therefore, should be 100% that the child will inherit AA, normal. Okay. If you have one parent that's a carrier for sickle cell, for example, one parent that has normal hemoglobin. Okay, so it should be a 50% chance that baby is a carrier, 50% chance that baby will have normal hemoglobin. Okay? So if you have two parents that are carriers, okay, so it's a 25% chance baby will have normal hemoglobin, 50% chance baby is a carrier, 25% chance that baby will have the disease or disorder. Okay, and that's in every single pregnancy. Okay? So in the UK, you should be identified when you're pregnant. Hopefully we see you before then. And if you are a carrier, we would ask for the baby's father to be tested. Once the baby's father's tested, if he's a carrier as well, then we know that there is a chance that the baby has inherited the disease. We can then offer you a test called prenatal diagnosis. Unfortunately, this is an invasive test. It can be done as early as 11 weeks. They don't tend to go later than 20 weeks. So it's an invasive test where they go under ultrasound, locate baby, ensure baby has a strong heartbeat, and then they would want direct access to the placenta or to the umbilical cord. They'll take cells with a needle and send that for DNA. That will give you the DNA of baby. If baby's a carrier, normal, or has the disease, okay? At that point, the woman would be offered a termination if baby does have sickle cell disease. And we offer terminations not because we want to eliminate sickle cell disease in our community. No, it's to give the woman that choice. It's to give the woman choice. So as I said, in terms of carriers, so if you've got one parent, for example, that's a carrier for sickle cell, one parent that's a carrier for hemoglobin C, there's a chance baby can have SC disease, okay? Again, with AD and AS, you can have the child as SD disease. Again, with hemoglobin E and AS, you can have SE disease. If one parent's a carrier for beta thalassemia, one parent's a carrier for sickle cell, you can have sickle beta thalassemia, okay? Again, a type of sickle cell disease. Okay, so the effects on the person. How does it affect someone? So anemia is the main first one, okay? Patient may appear pale, may have jaundice, yellowing in the eye, in the white of their eyes, will tire quickly. And remember I said the hemoglobin level can be as low as 60, okay? So they will tire quickly with activities of daily living or with any physical or emotional stress. So everyday activities, going to work, can be very difficult with somebody with sickle cell disease. Infection, so high risk for infection. In fact, we say that our patients are immunocompromised, and that's because we know the spleen does not work properly. Sickle cell disease used to be a disease of childhood. So as Samantha was saying, patients were often told that they would die before adulthood. This has completely changed now, and the reason for that is actually for penicillin. They did a study in I think it's in the 60s in Jamaica, where a cohort of children under the age of 5, half were with sickle cell disease, half were given a placebo, which is a medicine that doesn't do anything, and the other half were given penicillin. And they found that the children that were given penicillin did remarkably well in terms of not getting serious infections, for example, meningitis and pneumococcal infections. So they actually stopped the study early and said, actually, this is not ethical. All the children should be on penicillin. And actually, penicillin has been a game changer in pediatric sickle cell. Okay, so children are less likely to die from these serious infections due to having penicillin, and that's from as early as 12 weeks of age. So we advise patients to have it for life, but you can imagine how difficult it is to take antibiotics for the rest of your life. I know when I go to the GP with a chest infection and he says, you need to take this for the week, I'll probably only take it until I feel better. That could be 3 days and I discard. So actually telling someone to take medication for the rest of their life, you can imagine how difficult that is, especially if it's not making them feel better and it's not making them feel worse. But we do know that penicillin does work. Okay, so pain is unfortunately a very common complication of sickle cell, and that's because of these red cells obstructing the capillaries, blocking vessels, therefore restricting blood flow and the delivery of oxygen to vessels and tissues. Enuresis can also be a problem for those with sickle cell, especially more for children, due to the repetitive damage of the sickle cells to the kidneys. They find it very difficult to concentrate urine. And then there is progressive vessel and organ damage. So somebody can suddenly have a problem with an organ which we wouldn't expect them to have. For example, with the lungs, with the brain, any organ, because obviously blood goes everywhere in your body. Okay. The triggers for crises is infection, and as I said, that's in relation to the spleen, which doesn't work properly. Dehydration, so often we are asking parents to start their babies on water just to get used to the taste, because we want them to be drinking plenty. We want those red blood cells to be flowing through the body effectively. Extreme changes in temperature. So we know what the UK can be like. We can have 4 seasons in one day. And it's really important to be able to keep warm. If I compare it to those patients that I told you came from back home, usually from a warm climate, it can be quite a shock to come to the UK and to be exposed to cold. Okay. We often see patients come into hospital when it's raining, cold, windy, breezy, and that's because of the chilling effect. So when you're cold, you tend to shiver, okay? And the blood flow directs away from your arms and legs and actually focuses on your brain and the trunk of your body. And that's because that's where your most important organs are. So if you're taking away blood from your arms and your legs, there's poor blood flow going in those areas. So you tend to find people have pain in arms and legs because they're cold. So we advise anybody with sickle cell to keep warm as much as they can, to drink lots as well, okay, because you want the flow of blood everywhere, not just the trunk. We know that physical exertion and stress can be very difficult for somebody with sickle cell, and that's because you require more oxygen when you're stressed. You require more oxygen when you're running or doing an activity. So if you have less hemoglobin going through your circulation, you're not able to take in enough oxygen, okay? So therefore you will become tired quickly, and that could be stress-related or it can be in relation to activity. And then pregnancy is a massive trigger for patients with sickle. Again, you have the physical stress of carrying a baby, you have the emotional stress of carrying a baby, and you tend to find that you get triggered into crisis more frequently. So somebody who's pregnant with sickle cell would be seen more frequently. So I just want to highlight to you here on this picture that it affects your whole body. your whole body. Somebody with sickle cell, certain types of sickle cell, are at risk of strokes. This can be as early as 2 years of age. It's a very, very complex disease, and I'm sure there's still lots we do not understand or know about. But it affects your whole body. If it affects your whole body, it must affect the whole body of the family as well. So as I've explained, anemia. Jaundice is in relation to the repetitive breakdown of cells. So if your body's spending a lot of time making hemoglobin that breaks, which releases a pigment called bilirubin, which is yellow, if it's repetitively breaking down the hemoglobin, it has to repetitively try and catch up and make up that loss. So you heard Samantha mentioning there can be delay in growth and puberty, and that's because the body spends a lot of time trying to make hemoglobin. The human body is actually very clever, and it actually tries to compensate when things are not working as well as it should, but then it can cause a delay in other things. So as I explained in relation to crisis, painful occlusive crisis, it's because those red cells are not passing through. And you can see it, the blockages it can cause, which means it's denying that part of the body of oxygen, nutrients, and removing those waste products. Dactylitis is actually one of the first presentations that a parent normally has to deal with, the swelling of the hands or the feet. So you may notice, the earliest I've seen it is around 6 months, where you may notice that the child is not using a limb. So if they're crawling at that stage, may reserve not using that particular limb, or if you try to touch their hand, will flinch. Very, very scary for a new parent. We advise them to drink lots of water, pain relief, distract them. If they're unable to manage that pain, to bring them to hospital, where they may be given IV fluids and stronger pain relief. Pain can be chronic or it can be acute, okay? So acute pain obviously will be managed for a short period of time. But chronic pain can last a lifetime, okay? And this could be because of the repetitive damage that one has to bones, because of the denial of oxygen and nutrients to the bones. A common complication is something called avascular necrosis, quite commonly seen in the hips and shoulders, okay? And you'll notice in the hip, you have a ball and socket joint. For somebody that repetitively says they're having pain with walking, this is one of the areas that we would look at. Often you would see that the ball part of the ball and socket of joint is actually degrading and breaking down, and that is a result of not having oxygen and nutrients going to that part of the body. They may need a hip replacement. Okay. As I said, stroke is also a complication of sickle cell. You can have the obvious stroke, which we've all been advised about from adverts and campaigns. Fast, if you have a drooped face. Arms, if you've got a droopy arm. If you've got slurred speech or unable to speak, it's time to call 999. I'm sure we've all seen that. In sickle cell, you can also have something called silent strokes. So that's strokes that you cannot see, but you may notice that the person may be more forgetful, their personality might be changing. In children, you might notice that their academia may may be becoming worse. And this will be an indication to do further tests, for example, MRIs, to look at the vessels to see if they're being damaged by the sickle cells. Okay. So if somebody is having repetitive strokes, they would be advised to take blood transfusions. The blood transfusions would be to try and suppress the body making hemoglobin. So we would be giving hemoglobin to stop them making their sickle hemoglobin, okay? For some people, this still continues, even if we're giving regular blood transfusions, they may be still having these silent strokes or obvious strokes. And if that is the case, they would certainly be candidates to have bone marrow transplant, okay? So bone marrow transplant is when you have a sibling match that has the same tissue type as you. So it has to be same mother and father, same tissue type as you, and also to be a carrier or to have normal hemoglobin. Okay, and they would take the bone marrow from their sibling and give it to the person that's affected. Okay. This doesn't come without risk, because obviously anything that you introduce into another body is a foreign, and the body will fight against it. So what they do, they have to give you something that they call conditioning, which is effectively chemotherapy, okay, to wipe out your immune system, to stop you rejecting the bone marrow, okay? So if it's done for children, actually the success rate is very high. It's high in the 90s. As you become an adult, and this is probably one of the reasons why it's been delayed in terms of adults receiving this treatment. Samantha mentioned it's 2019, which it's been now offered for adults, is because by that time you may have had a lot of damage already in the body. Okay, and also, you know, not everybody has a direct sibling match. So that can be also a factor as well. But for strokes, if you're having repetitive strokes and blood transfusion is not working, bone marrow transplant would be the next option. And now they're even looking into gene therapy. And actually it has been approved, but we're just waiting for the NHS and NICE guidelines to agree on funding for patients with sickle. Acute chest crisis is effectively usually caused by pneumonia or some sort of infective process going in the chest, where you're unable to get oxygen in and get rid of the carbon dioxide. This is a big problem in sickle. Patients can often end up admitted even in intensive care. Spleen sequestration, so the spleen, part of your immune system, as I said, it doesn't work well in sickle cell, can effectively become confused with the sickle red blood cells and actually can pull all the red blood cells into itself. So you may notice that the person would suddenly have a large abdomen, look very pale, very fatigued, very listless. And when you take their blood test, their hemoglobin level could be as low as 2, really low. It's a medical emergency. Would need to get blood into them as quickly as we can. Samantha mentioned priapism. So this is actually a sickle cell crisis in the penis. It's when you have an unwanted erection. It is very painful. It would be the same treatment for pain relief, fluids, and if it's not going down after 2 hours, you would need to get into an A&E because, as Samantha mentioned, it can lead to impotency. Retinopathy, again, another complication, and can basically, the sickle cells have basically caused issues with your retina, which allows you to see. So the communication between the retina and the brain if the retina detaches from the back of the eye, can cause sudden blindness. Something that we don't talk about often, but actually quite common in sickle cell, is leg ulcers. These ulcers can just be caused by a gentle bump, maybe, on anything, and will start a sore that will not heal. Okay, you can imagine how debilitating that is. A sore that doesn't heal. If you're someone that likes to wear dresses, you wouldn't really want to show that off. You'd be covering it with a bandage. This can be very, very, very painful, and it's ongoing. Okay, very, very difficult to heal. So part of my job is encouraging people to get tested before they are pregnant. Okay. So in the last couple of years, I've sent to Islington GPs, Camden GPs, posters just to encourage any patients that are going in to get tested if you're planning on having a family. Just because most people don't know that they're carriers, and your GP probably doesn't know if you're a carrier or not. Okay? So you are welcome to ask your GP, but I know a lot of GPs refuse, not really sure if it's about funding. But try and look for your local sickle cell centre. I've had people come as far as Stevenage, Dartford, to come to me just to get tested. So you're welcome to come to the one in Hornsey Street, where I am. If you are both, so if a couple comes and you're both carriers, there are ways of avoiding having a child with sickle cell disease. So for the woman, she needs to be less than 39. I think they might have pushed it to 40, but less than 39 in age, BMI less than 30, I think, and a non-smoker. Okay, and the two of you must not have children from previous relationships that don't have sickle. If you do have children, then we can still go ahead with the process, but you'd be likely to pay. It's about 14 to 16 grand, okay? But if you both don't have children and you fulfill the criteria, you can be offered a specialized IVF called pre-genetic implantation. So effectively, they would make the woman make lots and lots of eggs, fertilize it with her partner's sperm, and we know that about 25% of those will have the disease. The rest will be carriers or normal hemoglobin. Now I'm saying like there will be lots. Usually the amount of eggs you can get, I would say, is around 6 to 10. You'd be lucky to get 6 to 10. And obviously we hope that 25% of them have the disease, and then the rest will be suitable for giving back to the woman in her womb or to freeze. Okay, but that is a way, and it is available. It is free on the NHS. A lot of people don't know that, so please spread that word. The other way, I've mentioned already, which I think is a bit more difficult, is when you're pregnant already. Okay. So that's testing at your first booking and then being informed that you're a carrier to test the partner, and then having the invasive test to tell you if the baby has sickle cell disease or not. Obviously, that's emotionally quite taxing to go through. Okay. I think we've gone through some of the prejudices and myths. So it's certainly not a black person's disease, okay? People do grow to adulthood, okay? And I think a lot of that is probably around penicillin, improved healthcare, some new medications. So Veloxetor and hydroxycarbamide are often used. There is cures, as I said, bone marrow transplantation and gene therapy. Everyone's pain is completely different. Everyone's pain is completely different, and it's really important to listen to the individual. They are the experts, as far as I'm concerned, and really important just to be compassionate and spend time understanding what they're going through. Certainly not contagious. As I said, it is genetic. If both people are carriers, not necessarily that their children have the disease. Okay. The next one, I'm not sick and neither is my partner, so our children cannot inherit disorder. Certainly not. My babies are carriers, so they might get sick later. No. Okay. There are certain conditions that we do tell carriers for sickle cell to be aware of. For example, high altitude. So if they're deciding to climb Kilimanjaro, where there's not as much oxygen, they may experience symptoms. Okay? Those that are going into the army or going to do some extreme type of sport where they're pushed to their limits, where oxygen demand will be high, they need to be aware that they're carriers because there can be symptoms. And actually there has been incidences of sudden death. We're not sure if it's because you're a carrier for sickle cell or something else. There are some airlines that don't allow their pilots to be carriers of sickle cell, and that's because obviously they're controlling a whole plane. If oxygen becomes an issue, then they can affect 200 odd people. Yeah. But generally you are a healthy carrier. If you are told that you are a carrier, really important to tell your family, really important to tell your friends. Friends to get tested, family because they may not be aware. There's a really good video on the Sickle Society website done years ago, really cheesy but really, really clear in how the myths around sickle cell works within families. It's called The Family Legacy. So if you get a chance today, try and look that up. It's called The Family Legacy. Just put The Family Legacy in Google, sickle cell. It's a 3-part drama, really, really, really good. I still use it with my students. Okay, so how can you help? Donate blood. A lot of our adult patients are on blood exchange programs, which means they will have 6 weekly blood transfusions. So it's a specialized blood transfusion where they'll take out the sickle blood and given donor blood. Okay, this can really help our patients in terms of their daily lives. Just their activities of living, being able to maintain a job, families manage their families, and just do everyday things. So if you can donate blood, that would be fantastic, especially if you're from a black ethnicity. Okay, so there are several subtypes of blood. Now, I'm not an expert when it comes to blood donation, but what I do know is that a lot of black people carry this subtype called RO. So if a lot of our patients are from black ethnicities, carry this RO, we can closely match their blood better. Okay, most of our donors are white Caucasian. So there are these slight changes in the blood. Yeah, so later can cause antibodies And once you start developing antibodies, it's more difficult to give you blood that you won't react to. Okay, so that's why there's a big drive in trying to have those from black ethnicities donate blood. So if you can, please do. I think I'm going to finish it there. These things you can read, and feel free to take my slides. If there's any questions, feel free to ask.
If you have questions, Assistant S is going to go around to you with the microphone so you can ask the question. We have 10 minutes of Q&As.
Sound.
Okay, 10 minutes of Q&A.
Sorry, my question is, because you spoke about penicillin for the treatment for people to be taking penicillin, and being that penicillin, some people are, how do they come? Some people are allergic to penicillin. So what would the others use if they are allergic to penicillin?
Yes, if you are allergic to penicillin, the important thing is that we're trying to give you a broad spectrum antibiotic, and its job is to be preventative in infections. So if you're allergic to penicillin, we'll give you an alternative that is also broad spectrum. Another question that often comes up in relation to penicillin is, won't you develop an immunity against it? So no, you don't develop an immunity against it, because we're not giving you a treatment dose, we're giving you a preventative dose, okay? So if you do develop an infection, sometimes you're advised to take the treatment dose of penicillin, or we'll give you another type of antibiotic to combat that infection, and then we expect you to go back on the broad spectrum antibiotic. I hope that answers your question.
There was a Miss Abby, she wanted to speak about her experience.
Hello, thank you very much, Grace, for your...
Hi.
Hello, I know Grace because I go to the West Teaching Hospital. If people see you, when you see someone who's got sickle cell, you might not even know that someone has got sickle cell. So not everybody, I know Grace showed about the presentation, but some people can look so normal. And so we should always just be mindful that some people can, like I've got sickle cell myself, people don't know I've got sickle cell. And then, I'm quite happy that, I've had all the symptoms. I know Samantha, I know people over there, so I've got sickle cell myself, and I sort of grew up having pain, but like what Grace said, I grew up in an African country, so I had pain, but I was able to manage. It's when I came here that I started having more problem with pain. So, and then I'll go to the hospital. Samantha has spoken about all the problems you have in the hospital, how to really solve. Problem can be people not understanding you, but people not knowing what to do for you. But the thing is to be mindful that, sickle cell pain is real, It's not something that people should be playing with. It's actually it can be an emergency thing that, as I said, you can actually end up in the ITU. So it's always very important that when there's some sickle cell, people take them serious and make sure that then look at as they said very early on, please get tested, because my parents didn't know much about sickle cell. When I knew I had sickle cell, they told me I wouldn't live past 21. I'm here. I'm now over 60. Thank God. Yeah. So I'm quite sort of happy to say that sickle cell is not a death sentence. It's something that can happen to people. And I know we always paint all the picture about sickle cell and everything else. But people with sickle cell, if they get the right support, they can actually live a normal life.
Yeah.
One thing I just want to emphasize that please give blood, because giving blood is very important. I do have exchange transfusions, which means that they take blood out of me and they give me blood every 6 weeks. And that really has been a lifesaver for me, because if not, like a couple of years ago, I was really, really bad. I nearly actually sort of lost my life, but I'm here. Thank God I'm here, because I'm a believer as well. But then, even though I'm a believer, I still make sure that I do the right thing. I take the right medication. I get the right help. and, and then, support people with sickle cell. So we want people to always support us. So please give blood, because as you said, there have been people who cannot even have blood anymore because they had sort of reaction to blood. They can't sort of have blood. So if you get a close match to you, you can actually live a normal life, So that's really been helping me as well, So thank you very much.
Thank you. Does someone else have a question here? There was a nurse that was working here as well.
1, 2, 3.
Oh, okay, let's go down this way. Let's go on.
Oh, hello, everybody. It's a question to Grace. What categories of sicklers can give blood? Is it people with SS, SC, AA? Well, what categories?
Okay.
So I believe sicklers can give blood, but I'm not sure on who can specifically give blood.
Okay, if you've got sickle cell disease, you cannot donate blood.
My sons have got traits. So they
Okay,
give blood.
so that's different. So trait is that you've got one normal gene and then you've got the unusual gene. So if you are a carrier, yes, you can donate blood, okay? There are sometimes they refuse. I don't know why. I don't know if it's because the percentage of the unusual hemoglobin may be higher than what they would like, but most carriers can donate blood. And remember, when you're donating blood, you're not just donating red blood cells. You're donating the white blood cells, the platelets, the plasma, and all of those things are important. Even if it doesn't go to a patient with sickle cell, it can go to cancer patients, it can go to a patient that's lost blood in surgery or trauma. So donating blood is great if you can.
Even if you're, I have the red cells exchange every 6 weeks. So in between those times, is it possible for me to give blood?
No.
It's not,
If you've got sickle cell disease, no.
No way.
You should not be donating blood. You need the blood.
Where's the next one? We've got their hand up.
Yeah, it's encouraging. NHS is offering IVF to parents with sickle cell and giving birth to very healthy babies after. What happens to those babies in future if they want to have babies with a healthy partner? What happens to that child? Is that child going to be healthy as well?
So you're asking me if their parents were carriers, they've had IVF, their baby is now a carrier, their baby's... Yeah, the baby's healthy carriers or healthy hemoglobin, AA. Is that what you're asking me?
In my understanding, the baby is not healthy because the baby was conceived by
The IVF shouldn't be relevant. So whether it was normal conception or IVF conception, if the baby's a carrier, they'll be healthy. If the baby has normal hemoglobin, they'll be healthy. In relation, the IVF shouldn't be an issue.
Sorry, I just wanted to understand, because I think I didn't get clearly, if one parent is straight and they're married to someone with full-blown...
SS.
Yeah.
Yeah, okay.
Now,
That changes.
if they have children, yeah, would each child, would anyone have a trait, or would they have the full-blown?
Okay, so it's a little bit different then, okay? Because if one parent has sickle cell disease, let's say it's SS, yeah, and the other parent is a carrier, let's say AS, yeah, so it's a 50% chance now that the baby will have sickle cell disease, 50% chance the baby will be a carrier.
Okay.
So it changes.
Okay, thank
Yeah.
you.
Oh, sorry, I'm going to be quick. At one point in time, when someone had a sickle cell crisis, the hospital wasn't classing that as an emergency, and patients had to actually sit and wait. Has that changed now? Do they go to the front of the queue? Because some people, a lot of people probably in here have not seen someone in a sickle cell crisis. My cousin, Pamilia, has blood transfusions on the reg. I had a friend 41 years ago, which they, people just didn't know anything. Are we allowed to say, look, this person has sickle cell, they're having a crisis now, please put them to the front of the queue? I mean, what's the system that's meant to be used?
That's a really difficult question. Unfortunately, it's not prioritised as much as it should be. Usually when someone comes into A&E with sickle cell crises, if that's their regular hospital, they should have what we call a protocol or pro forma, which is specialised to them, that they would have decided in clinic with their consultant. Okay, so they will, any A&E staff should be able to read that and be able to see what medication they're supposed to have. Okay, but they should have medication within 30 minutes of arriving to A&E. Yeah, the NICE guidelines ask us to ensure that they receive it within 30 minutes. The problem is, with the NHS in the state that it's in at the moment, even getting to be triaged by a nurse, for them to see you, to look at your protocol, sometimes you're waiting 2 hours. So they're not even getting the pain relief on time. Are they prioritised? I'd probably say no, okay? If it's in relation to chest pain, yes. Once they're starting to show signs where life can now be seriously at risk, then yes. But if you go and say, I've got sickle cell disease, blah, 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 this is my problem right now, no. That's really unfortunate, because we tell our patients, even if they're calling 999, to say, I have sickle cell disease, to try and push them up the queue. Unfortunately, it doesn't always help.
Thank you so much. Give her a round of applause. That was really, really informative. And I'm sure virtually everyone's going to leave here with such a much more better understanding of what someone who's suffering with sickle cell goes through. Because to be honest with you, I never know how deep it is. You just hear little theories of, oh, this, you hear crisis, but this thing really touch, and then obviously it's a touching thing. So today's been really great, and let's go there with this knowledge now that when you meet someone from sickle cell or even blood donation that you make, it's making a big impact, because I think Samantha on the video says sickle cell awareness saves lives, isn't it? Or something. Yes, it saves lives. So it's so, so important, okay? So I would like to once again thank the speakers. I'm sure we could have gone on for more to ask more questions, but we're going to conclude now with Pastor David, who's going to just give us a summary of some of the great work here we are doing with regards to blood donations as well. So, hello, Pastor David.
Hello, everyone. I have to say I've really enjoyed this event so far. Have you? Yes. I think it was really good. Many of the points that were raised, especially for myself. I don't know much about this topic, so I came here to learn. And one thing that I was really glad that you touched on many times was that out of everything that's been said, the most important thing that we can do as a community to support is by blood donation, which I have the figures of our recent blood donation drive that we had. In fact, it was my first time giving blood. Yes, and I actually did it because of this specific blood drive that we had. Never given blood before. When we heard about this blood drive, I put myself forward to be the first one. I got my results, and when you were speaking, I am O positive with an RO subtype. She just said, we want you. Yes. So I will be giving blood more, that's for sure, because my blood is the one that is specific for sickle cell sufferers. Or it's more ethnic, but my blood is important. And we got a lot of news of people who was their first time donors who also found out that they were the same blood types, various. I got an email this morning saying that 100 blood donors is enough to save people. I got it from the blood donation, NHS blood donation. And I'm glad to say that through our simple drive that we did, we managed to, out of all the people that came forward, of course, some people were not able to give blood for various reasons on the day, as you know. We managed to have at least 149 blood donors, raising 70 liters of blood. So strong clap to everyone. Amazing. And this is something that we're going to be doing more often, that's for sure. We're going to even find ways to even do pop-ups at our local centers. But I'm glad to know that at least we are contributing one way or another, and that's the work of the PCG. It's to contribute. The work that we do in the hospitals is to contribute towards people who are suffering. Sometimes people that don't have visits. I'm told that there are people that no one goes to visit them sometimes. Care homes, sometimes people don't go to visit them. We are there. We do the health point in various locations. We had the health point that we had in Edmonton. And I was really happy to hear that someone came and said that to have these basic checks that we were offering, which is the blood pressure checks, oxygen levels and all these things, for them to be able to have these checks, they would be in a long waiting line for them to go to their GP, but we were there to give it to them on first hand. And now I'm really glad to know that the blood donation drive that we did, not knowing the impact it will have, we didn't know how much it affects people, but as time has gone on, we've understood that we've made a big difference. And we're going to continue to make a difference. And I believe with the information that you've received here, I can speak personally myself. There are people that I remember that they had this that I didn't know no knowledge about. And, you know, as you both said, that sometimes there can be ignorance, right? Especially with the pain, right? Listen, you're in pain, be strong, isn't it? So it's good. We still combine faith in everything that we do, but learning makes us approach things in a very different way. And even going to see patients, I believe with the information that we have here, when you go to see a patient, even the way you're going to approach them will be very different. So I can say today was a very informative day. We will be organizing more events. This is our first one of this year. I can let you already know in advance that we're preparing ourselves for next month, because next month is Breast Cancer Awareness Month. And we will be organizing another session just like this in the month of October. I'll be letting you know more details, all right? We're going to conclude this session. They will be available if you would like to ask more questions. They're not here for long. They're going to record a short interview there, then they'll be available for questions if you like to ask questions. Refreshments are available on hand. And if you want to know more about the work of the PCG, I don't know if anyone here is for the first time being here, first time. Is there anyone here first time? Never been here before? Someone's hand is like this. So you're more than welcome, okay? We're gonna conclude now by playing a short video of the work of the PCG there at Edmonton. Cards are available if you want to know more about what we do, okay? And for you who are members of the PCG group, take the information that you received, this very, very informative information that you received, to make the work that we do even more effective. Because I honestly speaking, from my previous experience, today has been really good. And I believe that there'll be information left for people to go and check things after and learn more. Yes? All right, so our event is concluded. I'll leave the video playing on the screen. Please feel free to watch. Where is the video? A lot of slides. Okay. Do you have any leaflets or anything to give out to anyone? Any card? Okay. So people can scan. Do you have anything? No. No worry, no worry. Listen, when we have this again, are they welcome again, or? We've booked you already for next year. All right, everyone, thank you so much for coming. I'll leave the PCG video playing on the screen, and they'll be around if you want to ask questions. Pictures will be also available at the back. Light refreshments are available. Thank you all for coming. Have a wonderful Saturday. And for those who are members of the church, see you on Sunday.
From the patient care group here in Edmonton, and today we're here in Edmonton Green Shopping Centre doing the Health Point initiative. It's to get people just to understand a general health check. This week is the National Know Your Numbers Week.
Today I'm here with the patient care group and we're doing health checks on the general public. That includes taking their blood pressure, their heart rate, their oxygen levels, blood sugar, height and weight. So it's a full check for everyone.
What makes this project really, really important is that we're bringing healthcare to the community, so we're meeting people where they are. Nowadays, it's really difficult to get an appointment with the GP, so a lot of people put it off and they don't end up having the awareness of their health numbers. We try to do these health checks so we can reach people where they are in the community and we can pick things early, because if we pick things early, we can fix it before it becomes worse.
I think these checks are very important because a lot of the patients that I see in hospital, they wish that they had seen a doctor earlier, because prevention is always better than cure. It's better to identify if something's going wrong early. That way you can intervene, you can resolve it, sometimes just by changing your diet or your lifestyle, rather than waiting for it to get to too severe a situation and you have to be put in hospital or something worse. So if you're watching this video, my message to you is, it doesn't matter if something's running through your family, prevention is always better. Your DNA doesn't mean your destiny. With the right lifestyle, with appropriate checkups, you can keep a nice, balanced and healthy lifestyle.
As you can see, the beauty of this place today, it doesn't matter what culture you're from, what religion you're from, this is open for everyone, and this is a great initiative we're doing here in Edmonton.